So to move on in our agenda, I want to introduce our next speaker, and he has some of his staff up here. I see Dr. Travis Holyk, Executive Director of Health Services. Welcome, Travis.
Thank you, Julie. And health and child welfare are so integrated now that Mary actually took all of health's time, but we'll do the best that we can. So maybe we'll start with a round of introductions of the team, the leadership team. Go ahead, John.
Good morning, everybody. It's Dr. John Polovich here. Nice to see everybody. Adopted member of the Caribou clan from Stilatin and Notley, and acting medical director for Carrier Sekani Family Services.
Hi, everyone. I'm Rachel Wells, the Director of Quality and Innovation. Nice to see you today.
Hello, everyone. I'm Dawn Pearson, Director of Early Childhood Development. Hello, everyone.
Howdy, my name is Rhoda Holgren. I'm the Director of Community Health, and I sit with the Bear Clan, and I'm from Lake Valley Nation. Thank you.
Can I just interrupt? And there's a technical question that people are wondering how to send questions in the chat, and it is on the right of the live stream. There's a little chat box function, and you click on it, and you can ask your questions there. Thanks, Travis.
Okay. Denise Sakuze Skaze, Hadi Sootsen, Travis Holyk Satni, Sabuzi Biskai Satni, Gen CSFS 18 years Hababe Esta. Hello, everyone. I'm Travis Holyk. Some people call me Beast Guy. I've worked for Carrier Sekani for 18 plus years now, 19 in January. And I'd like to thank my team for all the hard work that they've done over the past year, both through a pandemic that we're experiencing, as well as the wildfire response that they were able to provide. They work tirelessly for the communities, and so I'd really like to acknowledge that, including the work of Judy Sanford, who I don't think has had a day off since the pandemic started. So we're really thankful to her team and all the work that everyone does. I also recognize the increased stress that this puts on the community, which leads to a lot of mental health and addictions challenges, and so we're doing the best that we can to address such things. And my heart goes out to the community for those who have lost a loved one during the pandemic. As an example of some of our commitment to the work that we do, I also should mention that we were successful once again in our accreditation. So every 3 years we get audited. 3 years because the highest standard that you can get is a 3-year accreditation. And so Carrier Sekani was successful once again. And on that, thank you to Kathy Scott. During a pandemic, it changed the way that we actually had to do the accreditation, where surveyors come in and they assess all of your policies, all of the work that you do at finance. They meet with clients, they meet with other organizations and ask them questions about the work that CSFS does. And once again, obviously there are areas for us to improve, but overall, very happy with the work that Carrier Sekani Family Services does. We also just last week went through sessions with our chief and councils, and so at that meeting I kind of felt like a talking head a little bit because I presented all the stats, and obviously the stats are really important because, like, in our intensive family therapeutic services, we kept another 30 children out of care, which is over 300 now children out of care within that program. And so we're proud of our stats. But what I did do this year to do our report a little bit differently is I actually asked our team for meaningful stories throughout the year of things that have happened in the community. I think those resonate well with people, and so bear with me. That's all I'm going to do in the report this time around, is just read some of those stories. And it's kind of weird because some of the stories come from team members up here, so I'm kind of reading their words. So starting with Dr. John around primary care. So in terms of our physicians, I think the story to be told is the unwavering, incredible commitment exhibited by the primary care team during the last year through the second, third, and fourth wave of the pandemic. The team has rallied to respond to all challenges, whatever, whenever, and wherever they might be. Helping our communities usher in the COVID mRNA vaccines, caring for ill patients and their families, checking in on patients in hospital at UHNBC, making house calls to homes and hotel rooms, taking video and telephone calls for patients wherever they might be, anytime, day or night, helping to transport needed medicines to communities, and helping to organize with specialists are just some of the sample of the daily work our team has done. Beyond COVID-19 related matters is the general ongoing care needed for each and every community member. The team understands the immense importance of keeping focused on this fundamental need for all of our community members. And then Charlotte Weninger, who is our medical office administrator, added, I heard countless stories of our providers working after hours on weekends to be sure healthcare was managed, following up the best they could through phone calls, telehealth, face-to-face visits, going to people's homes, advocating for testing or further care in larger centers. We had physicians offer immediate life-saving care while they were in the community, or even stopping along the way during their travels at car accidents and other events to provide the services that are much needed. And then Judith added, in terms of nursing, at 2 summer community COVID clinics, we had 16 adults who were hesitant to get their first needle, but showed up because of family. This was very significant and something we are proud of. The majority told me, and me being Judith, the reason they changed their minds on getting the COVID vaccine was because family asked them to get the needles. They said things like, I need to be with my family and grandchildren, or my daughter said I cannot go for supper or visit if I do not get the needle to keep the family safe. They also said, no one forced me to come to the clinic. I did it for my grandchildren who are too young to get the COVID vaccine. Judith also mentioned that at one of the early clinics, an elder came in to check out what was happening in the hall, and that he was clear with everyone, as you know how Judith speaks. He said, no needle, Judith. And we offered him a chair in a quiet spot to watch the activity. The elders had been isolating with very little social contact. We later heard him say, is that my sister? Who he had not seen for months. They connected, and then he followed her to get his first needle as well. CSFS support workers also did grocery shopping and delivery to families isolating in Prince George, Vanderhoof, and Fort St. James, and that continues as well. There's no cost for the service, and everyone is super appreciative. Judith said, one person said to me, Masai, I would not have got through this without the food for my family. A theme for this past year has also been collaboration. Sometimes situations arise that are deeply challenging and require several teams to work together to provide the best support possible to a family in crisis. When asked to share a story, Maternal Child Health stated that one family in particular came to mind. The youngest child was born with complex medical needs. A maternal child health worker provided support soon after the birth, helping the mother while she was isolated from her community. Once they returned home, the maternal child health team, as well as members from family preservation team, provided daily visits 7 days a week. They provided transportation to hospital for checks and helped with preparing and sterilizing bottles. Maternal child health workers supported children and families to Prince George and Vancouver on medical trips. They worked with a variety of teams within CSFS, as well as nurses, mobile medical teams, and pediatricians to ensure the family was well supported. The team struggled when the children were apprehended into the care of the ministry, but they worked hard to make weekly family visits possible. They supported other departments to bring the children together who had been separated into 3 different foster homes in 3 different towns. The maternal child health team celebrated when the children were able to return to the community. In the midst of a pandemic, with restrictions in place in communities we work, the maternal child health team sought to find a way to support families through a difficult, frightening, and isolating time. Group programs that had been in place suddenly had to change and adapt. Community Kitchen became the virtual community kitchen program, and maternal child health workers started a cooking show and also invited community members to make their favorite recipes on film. Ingredient kits were put together and delivered to 100 families from Prince George to Burns Lake to Takla and communities in between. Trust and relationships were built at doorstep visits where healing food was delivered. One client spoke of how she'd never cooked so much in her life. She was learning to make healthy meals for her family, with her family. She shared that it was helping her on the road to recovery from alcohol addiction. Food brings us together, and it was no different with the virtual community kitchen. In terms of mental health, finding creative ways to meet the needs of clients was also a theme of child and youth mental health this year. The team worked with others to set up spaces where virtual services could be accessed, drove miles to do all that they could to connect with young people that needed extra support, and knocked on doors to provide physically distanced check-in when schools were not open or children were not able to attend school. Things changed. They started with services that were outdoors. Then things changed when the bugs came in. First, the sessions continued with the bugs as part of the process, and when the sessions could no longer be done sitting still, new strategies came into play. When the fire season came, strategies had to change again. When weather turned cold and snow arrived and stayed, out came hats, gloves, boots, and when it got even colder, snow pants. Meeting a child outside, making physically distant snow angels was common. While this year was full of challenges, it was also full of successes, creativity, dedication, and determination. When asked to provide a story of their care, the Ubaya Clinic, which is based in Prince George, focused on how they worked together to provide safe care. Our family clinic days have resulted in families accessing care who would have been avoiding doing so. So the family days allow the whole family to come in together for a visit at the same time. Thanks to the safe environment, on one family visit day, a family came in and our nurse practitioner observed the young children needed immediate dental care. With the help of maternal child health worker and the perinatal clinician, the child was booked in with the pediatric dentist later that week. The dentist referred the child for immediate dental surgery. However, the cost was not covered as the child did not have a status number. The perinatal clinician was able to apply for Jordan's principle, which covered the cost of the surgery. All of this, including the dental surgery, occurred within 2 weeks of the child being seen by the nurse practitioner during one of the Ubaya Clinic family days. The addition of the perinatal nurse and perinatal clinician to the clinic team has allowed the team to work together to wrap services around families, which has resulted in positive outcomes like a newborn baby going home with their parents after birth. In one instance, parents who have other children who are currently in MCFD care had another baby on the way. Our perinatal team worked closely with MCFD and other CSFS staff to determine supports needed to prevent the removal of the child at birth. MCFD stated that they would allow baby to return to the family home with the parents if CSFS could provide daily home checks for the first few weeks. Our team was able to coordinate this and for 2 weeks provided daily check-ins on the family, weekends included. After 2 weeks, the family was referred to our Family Intensive Therapeutic Services, which works with a family 8 to 10 hours a week for 4 weeks straight. Without the daily checks that our perinatal team provided, this newborn would have been removed by MCFD. Months later, our perinatal team continues to check in with the family regularly. Baby is still in the parents' care, and the other children have been returned to the parents. This family came to our clinic in 2020 with their children in care, pregnant, and had just recently connected with one CSFS program that referred them to our clinic. By the end of their first visit to our clinic, our perinatal team had connected them to legal services, CSFS family support services, prenatal care, and mental health services. The clinic visit was a turning point for this family, and one our team is very proud of. Within intensive family therapeutic services, very similar stories. So a family the program recently worked with consisted of a single mother and 3 children. The mother was struggling with alcohol misuse. A worker from the urban family preservation team and a staff member at CSFS Youth Services both contacted us regarding the family, and I encouraged them to advocate with a social worker to refer the family to our program rather than remove. They did so, and the family was returned to us. At the start of services, COVID-19 was a challenge, so the clinician provided mom with an iPad to use during services, and they did a combination of sessions outdoor and some virtual sessions so the family could still engage in services. The clinician provided taxi vouchers on one occasion and met with the family at a community location as the family was unable to transport due to concerns regarding COVID-19. The clinician also assisted with addressing a number of concrete needs of the family to reduce the mother's stress, including obtaining a mattress for one of the children, taking a load of garbage to the dump, supporting the family in signing up for Salvation Army Food Bank, obtaining a one-time donation from St. Vincent's Food Bank, and getting the family a voucher for the thrift store so they could obtain clothing. The clinician also helped the mother sign the oldest child up for a babysitting course, which the program paid for, to help increase the safety in the home. One of the children was referred to the youth services and completed an intake for Walk Tall. This mother was initially hesitant to engage in our services, but thanks to the empathetic and non-judgmental stance of the clinician, her use of counseling skills, and her knowledge of community resources, the mother successfully completed the program, and at the end reported she wished she could continue working with the clinician even though her goals were met. The initial goal of the intervention was to support the mother in creating a plan for finding a safe caregiver for the children when she chose not to drink. The clinical engagement in motivational interviewing with the mother, and by the close of services, the mother was reporting that she no longer wanted to drink, and she signed up for drug and alcohol treatment program. At the end of services, the mother reported feeling less stress and stated that the family was spending more quality time together. Other service providers commented to the clinician that this mother was more relaxed than they'd ever seen her. The mother's feedback when the program was over, and we did ask to share these stories as well, was, I just want to say thank you for everything and your help getting personal things I needed to get done. You went above and beyond for me, and I'm very grateful, even when I wasn't in a good mood. Finally, early childhood development shared 3 additional stories. So I had one young child who has not been verbal with anyone and was struggling with behaviors at home and in the Head Start. I took the child and grandma to the equine session, and the child spoke 2 words to grandma for the first time. Both grandma and I had tears in our eyes. I had a drumming session with the infant and toddler group, and they were so intrigued by the songs and bobbed their little heads to the sound. The next day, they saw drums hanging on the wall and started to point at them and ask us to bring them down for them. We took them off the wall and brought them outside, and each child got their own drum. They instantly started to drum and mimic their sessions from the day before. It was a beautiful moment to see our young generation learning their culture. And finally, we had a family that was really reluctant to engage in any services. I would continually stop in and say hi and deliver a good food bag. On the day the family invited me in, one day the family invited me in, and from there we were able to develop a relationship and provide services for her child, such as developmental assessments, getting her child to a pediatrician, and having the child accessing child development programs. So to all my staff, thank you for sharing your stories. I think that they're really important and really valuable, and it really does show the work that you have done. Also, to all my staff that was selfless and got vaccinated so that we can continue to provide services, like that to me also shows the social responsibility that we have as an organization to the communities. I know that COVID has ravaged our communities, and so I think in the DAC Health way, we support one another and we do what we can as a community. And so getting the vaccine is part of doing what we can as a community. So on behalf of my entire team, I'd just like to say, Snachalya.
Wow. Thank you so much, Travis. So we have some questions online. And so if you want to take a sip of water, we have our first question.
Perfect. Thank you. The first one has generated a bit of discussion, so I may have some follow-up, but it's around rapid testing. So we're being asked how people in communities can access rapid testing, where it is available, and then I may have some follow-ups.
Okay. So right now, we do have rapid testing machines in Takla and on the south side. They are still like in the works as far as like getting the quality assurance piece of it done. The best is always still to have the full swab. So rapid testing, when we met with the PHO's office, as well as Northern Health, they recommend, so if there is an outbreak in the community, that would be a time to do rapid testing, but it's not generally done on kind of just a daily basis. With that, when we do have outbreaks where people are symptomatic, we typically have Judith and her team going in and doing swabs.
Okay, so it's not regular practice, it's for specific situations?
Correct.
Okay.
The other recommendations that they have is, so for a workforce, if you did have individuals who weren't vaccinated and you wanted to do kind of like a weekly, so 3 times a week type of service for that type of rapid testing, that's the other area that it's been deemed to be effective, with the idea that so sometimes when people do go to a larger gathering, typically the virus wouldn't show up for roughly about 4 days anyway. So someone could take that rapid test if it's like just the little kit that I think you've seen. If someone did take that the day after the event, they may think, oh, okay, I don't have COVID, and they may go out to other events and become a super spreader. So you do have to be very careful in terms of how those rapid tests are used.
Okay, knowing that there's cautions, and thank you for outlining that, we did get a question asking if it was possible to train health managers and community health representatives to conduct rapid testing. But if you could address that, but also obviously with the recommendation that these aren't to be used as regular practice. So
yeah, and absolutely that is a possibility as well, so that they're done appropriately. So the PAM bio test itself isn't quite as effective as the like actual nasopharyngeal swab. And so obviously that's the best case, but yeah, like we can train individuals in how to use those tests.
Thank you. The next question is around transportation. One of our participants has recognized that there are transportation barriers in many of our remote communities, and I'm wondering if you can outline some of the work CSFS, I can't pronounce it. CSFS is doing to break down those barriers around transportation.
Okay, is it transportation related to COVID? So I can speak to that. So one of the things that we have done is partner with Mary's team. And so in the Burns Lake area, there is an identified individual that if people need to go for a COVID test, they will pick up that person and transport them to get a COVID test. Does anyone else have anything to add in terms of transportation as a whole?
the team is
Yeah,
just...
and if they can clarify as well as this question about the MTV, the mobile transport vehicle, as well.
It is not specific, so we'll just give them a moment to chime in, and maybe I'll move on to the next question,
Okay.
and we can come back to it. So the last question I have for you at this moment is around Baby Alert. I believe it's also known as, that's the early alert between hospital and social services. Is Baby Alert, does it exist in this region? Is it legal?
I think you mean birth alerts.
Or sorry, Birth Alert is the other
I know
name.
nothing of that. Is someone...
I'm not sure if Mary could answer that. A question about birth alerts, or does it exist and are they legal? So the practice of birth alerts has been canceled for over a year, and if there is, it is not legal.
Thank you kindly. And then one person is just commenting that given the time that the variant spreads, it seems to me we should be proactive instead of waiting for an outbreak to happen. I don't think anybody here would disagree. I suspect this comment might be specific to the rapid testing again. So if you could just go over the function of rapid testing and that it is not actually considered a preventative measure, or however you'd like to articulate that.
Correct. So the one time that it would be a preventative measure would be if an employer is using it if somebody had an exemption, that would be a way of ensuring that a staff member is tested, say, on a Monday, Wednesday, Friday, so that you know that when they are going into the community, that they are not going to be the super spreader.
Thank you.
Question at the back.
Okay, thanks. We've had many requests from communities about employing rapid testing in their communities, and certainly we'll be examining that, including training people for rapid testing, just as a reassurance that if there is an outbreak, they have some evidence that they will work with to respond to some of the COVID outbreaks. So that was really important to many of the communities, which was also addressed last week by some of the chiefs. The other issue is we all know that there was a report completed by Mary Ellen Chappelle-LaFond around racism encountered in hospitals. Now, I'm not quite sure where Mary Ellen is at, but I know that they've established a committee or a team to respond to the recommendations. From what I understand, I'm getting reports that many of the people that in our communities are still experiencing racism. So that also needs to be addressed, and perhaps get in contact with Mary Ellen's office to see what their plan is moving forward.
And Warner, on that, so if people have stories to share, Wilf and I have been touching base, and so I've been working directly with Wilf and sharing those stories. Even at the event today, somebody shared a story. So you can definitely contact me, and then I'll work with Wilf so that those stories do get addressed at higher levels.
Okay, great. The other mention that I wanted to provide was an update on the mobile diabetes program that Matthew undertakes in northern British Columbia, including some of our community. So maybe Matthew, if you could give a quick update on the stats. I'm putting you on the spot. your team.
So I think Matthew is preparing himself to go up to the mic. Somebody can answer transportation?
A few minutes. No, go ahead. You need to go.
You probably need a mic, Matthew.
Okay.
Or you can come up here. You can use this mic. All right. Matthew.
So just a quick, a brief update, since Warner has asked me to. For many years now, of course, the mobile diabetes clinic has been in operation across northern BC. Of course, for the past couple years, we've had to very carefully maneuver ourselves around COVID outbreaks and also partner in the COVID vaccine campaign with Carrier Sekani and with our larger partner, FNHA. But in terms of the last year, when we look at how we've had to shift, most of it has shifted to telehealth, which has been partnering over phone, over Zoom, over text messaging where we can. And it's really, if we look at the shift from our numbers where we would normally meet with patients face-to-face, we've gone to this past year virtual to almost 3,000 encounters, which in years in the past we've done 100, 200, but this past year we've really shifted to about 3,000 virtual. So that's where we're heading to in the future. And again, as we move forward, we're trying to establish diabetes nurses in the different regions, in the different pockets. So we've started again this past year in what we call the NERD area, which is the Northern Teacher Regional Divisions of Family Practice. So we've partnered with Fort St. James, Burns Lake to really do a more concerted effort at bridging a lot of those gaps that our folks with diabetes encounter. Because we want more client contact, and we know that more client contact results in better outcomes. So really, I just wanted to provide an update in terms of our virtual encounters, which have probably multiplied by about 400 or 500% in this past year. And that's something that we are very proud of. So thank you. We continue to put our pressure on our First Nations, on First Nations Health Authority to help expand our program in ways where it needs to happen, because there are a lot of people that still are not getting the support that they need, and they don't get that support unless there are the people there to help provide that support. And so we continue to advocate position at a time. We've grown over the years. Each year I think we've gotten a new, this year we've had a dietitian, but each year we've sort of grown that piece by piece, but we need to continue moving forward on that. Thank you, Masai.
Thank you so much, Matthew. Awesome job at the last minute being put on the spot. So are there any other questions for Travis? Yes, there is.
Yes, you're popular today, Travis. So we do have a question here about booster shots. The question is quite specific, but you're welcome to talk about booster shots if you're willing to at greater length. This person would like to know if we need to do a booster shot with the Moderna vaccine.
Yeah, so actually I was just in a meeting at 10:30 where we were discussing the booster shots for the communities. And so, yeah, for all vaccines, the idea will be that there is a booster shot. I know that a lot of people have heard that that is January, but I can say that what they are working through is when those booster shots will take place. So those with chronic diseases and also First Nations were target populations when we did the first vaccine. And so the idea would be that kind of from that 6 to 8 month out period of when people had their vaccinations, that would be the time. So January isn't necessarily that date. And yes, kind of all vaccines, although Moderna does have, seems to have a little bit longer lasting impact because there is more of the active agent in Moderna, it probably still will be a booster shot with Moderna as well.
Thank you. And we are going to have a panel after lunch talking about COVID vaccines. And I really want to appreciate all the questions. We're out of time for questions, but if people want them answered, you can email communications@csfs.org. And then also stay tuned for the panel discussion after lunch where we'll have more discussion about COVID and vaccinations.
Are we just going to let Mary answer?
Oh, Mary, you wanted to answer a question about transportation? And I appreciate people's patience and indulgence. We let you have extra long breaks, so we're going to eat into your lunch hour a little bit.
Okay, so the transportation question in general with our communities. So we were part of the Highway 16 Transportation Action Plan. So through that transportation, we have established the First Nations Drivers Training Program through CSFS. And again, that was those ones that they may have vehicles but didn't have their license, and that was an issue across all our communities when we did the surveys about 5 years ago. There's also the grants for community vehicles. Right now, SICAs, Nitaiban, Takla have monies or have community vehicles for transportation. And of course, you see that we have the BC Transit expansion, so it's like a $5 ride between Burns Lake and Prince George. There's routes between Smithers to Whitsett, Burns Lake to PG, Burns Lake to Smithers, and Terrace to Hazelton. There's also the collaboration, the ongoing collaboration between First Nations Health Authority and different transportation places to try to fill the gaps. I know one of the questions that were asked is around the Greyhound, but we will be convening a meeting to discuss those additional gaps. I always say transportation is a social determinant of health, so we are working on that. But also, our staff collectively provide transportation to the families we're working with. So some of the families that need to go shopping for groceries or to visits for their children or things like that, we do provide some transportation.
Thank you, Mary. And like I said, if you have other questions that have been unanswered, email communications@csfs.org and stay tuned for the discussion after lunch. So let's hear it for Dr. Travis Holyk and his team, all the hard work that they've done over this year, helping us get through this difficult time. Thank you.